We spent this week in the ER twice. One night it was chest pain. The next, Dave passed out cold and I called 911. But the system worked. And for anyone saying Canadian healthcare is broken, this is our story. So this week, we got a crash course on how the Canadian healthcare system works. And guess what? It does. So to all the haters out there calling it broken, pull up a chair. This one's for you. On Sunday night, Dave had chest pains. Yep, middle of the night, no warning. So I did what any good wife does. I threw on my big girl pants and drove straight to the hospital. At the triage, the nurse checked his vitals. They checked his blood pressure and heart rate, and they were all solid, so it wasn't considered an emergency. But even so, within minutes, he was signed in. And then it was boom, EKG in 10 minutes, blood work in 30. Then we waited an hour or so for the results. Fair enough. When the nurse came back, the blood and EKG all looked okay, but they still wanted the doctor to check him out anyway, because chest pain, that's not something you mess with. We waited another 2 hours or so to be called in, and yeah, we saw ambulances coming and going, so we got it. Life-threatening cases go first. That's how triage should work. When we got in, the doctor did a full exam. He looked at Dave's family history and sent him for a chest x-ray. Thank God everything was clear, but something still didn't feel right, so the doctor kept digging. Turns out it's something called costochondritis. That's swelling of the cartilage between the breastbone and the ribs. It's super painful, but not dangerous. 8 hours later, we left with answers. We had referrals to a cardiologist and a stress test. And what did we pay? Exactly nothing, except for $7 worth of parking. Unfortunately, we didn't wear masks in the waiting room. Rookie mistake. After we got home late in the morning, we crashed. I had no appetite, I was aching all over, and I thought it was just the result of having no sleep. The next night when I finally ate some pasta for dinner, let's just say it didn't end well. Picture The Exorcist, but with less pea soup and a lot more regret. Unfortunately, the next morning, Dave woke up with diarrhea. And then vomiting, and then both. And then he passed out on the toilet. Yep, that really happened. He came to on the floor, vomited again, and then passed out again. And that's when I said, nope, it's 911 time. The ambulance arrived in 10 minutes, and he managed to pass out another 2 more times. It turns out he has something called vasovagal syncope. I don't know what that is. But it says that his vagus nerves gets overstimulated, and that makes him pass out. And yeah, Dave has a history of collapsing on me. He always passes out in the most dramatic fashion, freaking me out. They took him to the ER and they hooked him up to IV fluids and ran the usual tests of blood work, EKG, meds, the whole works. 4 bags of IV, and 5 hours later, he came home. Still sick, but stable. And yes, another $0 hospital bill. I spent a lot of time in Canadian hospitals the past 2 years. I had breast cancer, a double mastectomy, reconstruction, more MRI, CT scans, and ultrasounds than I can even count. So when I hear people, especially our politicians, say our healthcare system is broken, I say this: it's not perfect, but it works. It saves lives. It saved mine, and it saved many people in my family more than once. What's broken is this idea that we should privatize it, that we should follow the US model, that we should elect leaders who want to cut it. Pierre Poilievre voted to slash $196 billion from public health care. Billions gone from surgeries, emergency rooms, and frontline care. Doug Ford did the same thing, and Ontario still voted him in. I'm sorry, but I don't want that kind of leader. I don't want another Trump, and we don't need a Make Canada Great Again knockoff slogan. Canada is great, and public healthcare is one of the reasons why. You can't fix something by gutting it. You fix by investing in it, supporting in it, and voting for leaders who actually believe in it. This week, we saw the best of Canadian healthcare up close, twice. And before I wrap this up, I need to say something important to the nurses, the doctors, the paramedics, and the hospital staff. We see you. We saw how hard you worked this week. We saw the long hours you put in and the calm under pressure. We saw the compassion and the professionalism, even when people were yelling at you for doing your jobs. At one point in the ER, there was a man scolding a nurse for making him wait. He already had a bet. He was up and walking around like nothing was wrong. So was it life and death for him? No, but he was still demanding to be seen faster. And you know what that nurse calmly said? "Emergencies are first, sir." And she's right, because that's how it works. You don't get bumped to the front of the line just because you're loud, and you don't yell at the people trying to keep other human beings alive. So thank you from the bottom of my heart and from the both of us. You saved Dave this week, and you saved my sanity. If you have any medical stories that you'd love to share with us from your country, we would love to hear it. We want to hear stories from around the world to see how other medical systems work. And if you enjoy this video, make sure to subscribe because we put up videos like this every week, sharing truth, information, our opinion, and a little bit of humor each week.